Wales introduces UK's first gluten-free food debit card, Coeliac disease support. In a groundbreaking initiative, the Welsh Government is set to introduce a gluten-free food debit card for its residents who are unable to consume gluten, marking the first of its kind in the United Kingdom. This revolutionary approach, which will be implemented later this year, aims to provide an alternative to the existing system where individuals suffering from conditions like celiac disease, which affects approximately 1% of the population, receive gluten-free food through pharmacy prescriptions. Cheryl Barker, a 54-year-old resident of Narberth, Pembrokeshire, participated in a pilot programme and received £14 per month, which she believes only covers a fraction of the actual cost. According to a Coeliac UK report, maintaining a gluten-free diet can increase food expenses by 35%. Health Minister Jeremy Miles stated that the Welsh Government objective is to de-medicalise the distribution of gluten-free foods. The new debit-style card will function similarly to a chip and pin bank card and will be accepted at various locations selling gluten-free food, including supermarkets, shops, community pharmacies and online stores. The exact amount that individuals will receive has not been disclosed, only that it will vary based on individual needs and be subject to regular review. The government has not revealed the total expenditure on the scheme, but anticipates it to be cost neutral and not add to the NHS budget. The prescription model will remain available in Wales, similar to those in England, Scotland and Northern Ireland. Coeliac disease patients cannot consume gluten, as their immune system attacks their own tissues, leading to malabsorption of nutrients. Symptoms include bloating, vomiting and diarrhea. Gluten-free food is more expensive in major supermarkets like Tesco, Asda, Sainsbury's and Morrisons. Ms Barker, who has been part of the pilot programme in the Hywel Dda Health Board area for the past 5 years, receives £42 every 3 months, equivalent to £14 per month. She described the previous prescription system as slightly embarrassing and the food as not very edible. She emphasised that a gluten-free diet is not a lifestyle choice, but a necessity. Bethan Williams, a 24-year-old Cardiff resident, found the prescription food to be of low quality. As a vegetarian, she believes the cash cards will empower individuals with additional dietary needs to make healthier choices. She advocates for everyone's right to a balanced diet, not just a privilege for those who can afford it. Gemma Beer, an employee at the Plum Vanilla Cafe and Deli in Narberth, which accepts the cash card, noted an increase in customers with gluten-free requirements. However, balancing the high cost of gluten-free items with minimising waste is a challenge. Health Minister Jeremy Miles believes the new system will reduce administrative burdens on GPs and pharmacies. He stressed that a strict gluten-free diet is a medical necessity for coeliac disease patients, not a lifestyle choice. The guy if they give people more freedom to access the food they need to manage their condition. Tristan Humphreys from Coeliac UK emphasised the importance of recognising a gluten-free diet as the treatment for coeliac disease, a serious autoimmune condition, not a lifestyle choice. He believes supporting patients' diet will prevent future health complications and is cost-effective for the NHS. He urges other UK nations to follow Wales' lead. Wales launches gluten-free food subsidy card, empowering choice for celiac patients. In a groundbreaking move, Wales is set to introduce a prepaid card system that will revolutionise the way people with gluten-related conditions access their food. This innovative scheme, known as the Gluten-Free Subsidy Card, is designed to give individuals with conditions such as coeliac disease and dermatitis herpetiformis greater freedom and choice when it comes to their dietary needs. But here's where it gets interesting. This initiative aims to de-medicalise the supply of gluten-free foods, allowing people to access a wider range of products in supermarkets and online, rather than relying solely on prescriptions. This is a significant shift in approach, and one that has the potential to spark some lively debate. The scheme, which is set to be rolled out across Wales from autumn, is an alternative way for people to access these foods. Those who currently receive gluten-free food on prescription will be contacted by their health board once the scheme goes live in their local area. The Cabinet Secretary for Health and Social Care, Jeremy Miles, emphasised that following a strict gluten-free diet is not a lifestyle choice, but a medical necessity for those living with coeliac disease. The scheme aims to reduce administrative burdens on GPs and pharmacies while promoting a more effective use of NHS resources. It's important to note that people will still be able to get gluten-free food on prescription for free. This is a choice which is being given to patients, providing them with the flexibility to choose what works best for them. The new card scheme has been extensively tested in Coeliac University Health Board with positive feedback from participants. Cheryl Barker, who was diagnosed with coeliac disease in 2007, was part of the pilot scheme and has been using the card for 6 years. She shared that after being diagnosed, she quickly realised that maintaining a gluten-free diet would be costly, with limited shopping options and hit-and-miss food choices. The card has empowered her to buy the food she wants and make better lifestyle choices, contributing to a healthier life. Dietitian Alison Jones, who led the successful pilot and implementation at Coeliac, expressed her delight at seeing the card being adopted across Wales. So what are your thoughts on this new initiative? Do you think it will improve the lives of those with gluten-related conditions? Or do you have concerns about the potential implications? We'd love to hear your views. Wales introduces gluten-free subsidy card scheme for celiac disease patients. Imagine a world where a simple card could transform the lives of those living with gluten-related conditions. Well, Wales is about to make that vision a reality. The gluten-free revolution, a game changer for celiacs. In a groundbreaking move, Wales is introducing a prepaid subsidy card for gluten-free food, offering a new level of freedom and choice to individuals managing gluten-related disorders. But here's where it gets controversial. This innovative scheme aims to de-medicalise the supply of gluten-free foods, shifting the focus from prescription-based access to a more flexible, consumer-driven approach. The National Gluten-Free Subsidy Card Scheme, a UK-first initiative, empowers people with conditions like coeliac disease and dermatitis herpetiformis to take control of their diets. Instead of relying solely on prescriptions, they can now access a wider range of gluten-free options in supermarkets and online. A personalised approach to dietary care. Eligible individuals will have the choice between a traditional prescription or the new card scheme, tailored to their specific needs. The contactless card, functioning like a prepaid MasterCard, will be topped up every 3 months, ensuring a steady supply of gluten-free essentials. And this is the part most people miss. When purchasing gluten-free foods, they must be scanned separately at the till to ensure accurate payment with the card. It's a small detail, but it underscores the scheme's commitment to precision and convenience. A win-win for patients and healthcare providers. The scheme not only benefits patients, but also eases the administrative burden on GPs and pharmacies, promoting more efficient use of NHS resources. Dr. Richard Brown, a GP at Crosshand Surgery, praises the card for its flexibility and cost-effectiveness, supporting patient independence while reducing pressure on NHS services. The pilot programme, led by dietitian Alison Jones at Coeliac University Health Board, has been a resounding success. Cheryl Barker, a participant in the pilot, shares how the card has empowered her to make better lifestyle choices and manage her coeliac disease more effectively. A glimpse into the future of healthcare. With the scheme set to roll out across Wales this autumn, it's an exciting time for those managing gluten-related conditions. The subsidy card scheme, coordinated by health boards and the NHS Wales Shared Service Partnership, is a testament to Wales's commitment to innovative healthcare solutions. So, what do you think? Is this a step towards a more patient-centric healthcare system? Or does it present concerns about the convenience, the sustainability, and accessibility of specialised diets? We'd love to hear your thoughts in the comments.